All right, coming to a drugstore near you, if it hasn't already, rising prices. A lot of companies, led by Pfizer, for example, which raised prices on better than 40 to 50 key and popular drugs and prescriptions, others following suit. The administration is saying this has got to stop, but it doesn't stop. The president saying that this is offensive. Already we've seen his Secretary of the Health and Human Services, Alex Azar, saying of these price hikes, particularly Pfizer's, that change is coming to prescription drug pricing, and whether it's painful or not for pharmaceutical companies, they will face it sooner rather than later. He goes on to say that the drug companies that recently increased prices will be remembered for creating a tipping point in U.S. drug pricing policy. That's a pretty clear threat. The read now from Dr. Janette Nesheiwat on what, if anything, the White House does now to follow up on that threat. Doctor, it's always good to see you. What do you think?
Good to see you too, Neil. Well, these excessively high drug prices and the foreign freeloading is really taking a toll on the American people. Pfizer just raised the price of 40 drugs up by about 10% each. And that's 10 times the rate of inflation, 10 times faster than economic growth. And, you know, I have patients that have to choose. Sometimes should they go and get their medication, or do they need to, you know, save that money to pick up some food? They shouldn't have to choose. You know, we have the most advanced medicine and technology in the world, and now we're dealing with what seems like price gouging by these pharmaceutical companies because there's really no good or clear reason why they are raising these prices other than the pursuit of profit. And if they keep up at it, they're going to get fined, just like Mallinckrodt was fined $100 million for raising the price of Acthar, which treats multiple sclerosis and infantile spasms, from $40 a vial to almost $40,000 a vial.
You know, the president, when he was noticing this, he said in a tweet that Pfizer and others should be ashamed that they have raised drug prices for no reason. Now, the companies argue that some of these items on which they hike prices, it had been a while since they were hiked, but they're already, in the case of many, quite expensive. So what is the recourse here, and how do you prove it? And then what do you do as a doctor for your patients who might need these drugs? I mean, you have to look for an alternative, I guess, if there is one, right?
So the solution is, first of all, these are life-saving medicines to treat blood pressure and diabetes and cancer medicines. So people need these to live and to survive. But part of the solution is our president wants to eliminate the middleman. You know, either put some strong restrictions on PBMs, the pharmacy benefit managers, or share those rebates that the pharmacy benefit managers are pocketing with patients, with the consumers. So doing that, and also, you know, looking at, I know our administration is looking at reforming Medicare Part D to allow more flexibility to for Medicare and Medicaid to directly negotiate with pharmaceutical companies to get better deals, and also to allow for more competition and innovation of new drugs. But there are things that I always offer to my patients. You know, I always say, look, shop around. You know, the prices for medicines are different at different pharmacies. So shop around, print out a coupon. I'm always printing out coupons for my patients to save them money. You could also ask your doctor for a substitution or a generic medicine. And even, you know, always a good idea, ask your doctor if they have any samples. And it's also important for patients to know and understand that there's what's called the gag rule. And sometimes if you pay out of pocket, it's much cheaper than using your insurance. But pharmacists are not allowed to tell you that because of the gag rule. So lots of reform that needs to be done to help save money for our patients so that they can have the medicines that they need.
All right. Now, we tried to get a representative from Pfizer and some of these other companies to talk to us here. They did put out a statement, and this has been echoed in some of the Wired stories, that the list price, this is coming from Pfizer, doctor, remains unchanged for the majority of our medicines. Our portfolio includes more than 400 medicines and vaccines. We are modifying prices for approximately 10% of these, including some instances where we're decreasing the price. Of course, what's left out there, they're referring to the number of medicines, not the fact that these are sometimes among the most expensive, so disproportionate price-wise. But you mentioned what you could do maybe in your office if you find coupons or alternatives, or you can find something that it will work just as effectively for a lower price. But I invariably notice that the impact is usually on poorer patients than it is on richer patients who have options. And it's no mystery that those with threatening diseases, multiple sclerosis you mentioned, generally, if you make a good buck, you have a better odds of making it with that disease than someone who doesn't. That's not right.
It's not, and there's a huge lack of transparency, which is a major problem. That's why our president wants any drug companies that are putting ads on TV or billboards to list the prices of their drugs. And on top of that, you know, lower costing drugs are being kept off the market because pharmaceutical companies are gaming the patent process. It takes, you know, they get to have a patent for about 20 years, and they're always extending it by making little tweaks to their medications. And that creates unfair monopolies. And, you know, those who suffer the most are those who are poor, that are vulnerable, or are senior citizens. Last year alone, the top 20 most prescribed medicines for our seniors went up tenfold. That's just criminal to me.
Yeah, it can't be done. And this is not sort of like furniture or anything else, not a typical commodity or a product. This is life-saving stuff. So stop it.
Right, and the prices are just going up year by year. Last year was 20%. This year is about 10%.
We can do better as
sure
a country without risking capitalism or any of that stuff. Doctor, thank you very much. We'll have more after this.